Ever wondered how something as simple as breathing can become a complex medical condition? It's not something most of us ponder as we go about our day. But for those living with respiratory tract disorders, it's an everyday reality. Understanding these disorders is more than just academic curiosity. It's a crucial step towards developing effective treatments and improving the quality of life for millions worldwide. Let's start with the basics. Bronchial asthma, chronic obstructive pulmonary disease, COPD, and cough are common respiratory disorders that affect millions each year. While they may seem different on the surface, they all involve the respiratory tract and can significantly affect a person's ability to breathe normally. Unraveling the intricacies of these disorders is like solving a complex puzzle, and the pieces are often found in the realm of pharmacology. In the next few minutes, you'll grasp the basic pharmacology behind drugs used to treat these conditions. So, let's dive in, shall we? Imagine gasping for air, the fear and panic. This is the reality for those with bronchial asthma. Bronchial asthma is a chronic condition of the respiratory system where the airways or bronchial tubes become inflamed. This inflammation causes the airways to narrow and produce excess mucus, making it difficult to breathe. It's akin to trying to breathe through a straw that's slowly being pinched at one end. The symptoms can vary from person to person but generally include shortness of breath, chest tightness, wheezing, and coughing. These symptoms can be mild, appearing only at certain times, or they can be persistent and severe, significantly interfering with daily activities. A key aspect of asthma is its triggers. These are environmental factors that can cause an asthma attack. Common triggers include allergens like dust mites, pet dander, pollen and mold, irritants in the air such as smoke and chemical fumes, and even certain medications. In some people, exercise, cold air, or even emotional stress can trigger an asthma attack. It's important to note that triggers vary widely among individuals, so what affects one person may not affect another. Inflammation plays a significant role in the development and exacerbation of asthma. When the airways become inflamed, they become more sensitive and reactive to triggers. This inflammation is driven by an overactive immune response in the body which sees harmless substances as threats and reacts by releasing chemicals that cause the airways to swell and tighten. Now you might be wondering, can bronchial asthma be cured? Unfortunately, there's no cure for asthma. However, it can be managed effectively with the right treatment and lifestyle changes. Understanding bronchial asthma is the first step in managing it. By recognizing the symptoms and triggers and understanding the role of inflammation, individuals with asthma can take control of their condition and live full, active lives. Now that we understand the condition, let's delve into the drugs that combat bronchial asthma. The pharmacology of drugs used in bronchial asthma is fascinating and vital for effective treatment. Now, let's dive into the types of drugs used in bronchial asthma. Broadly, we can categorize them into two types: relievers and preventers. Relievers, as the name suggests, provide immediate relief during an asthma attack. These include short-acting beta agonists like salbutamol, and they work by relaxing the muscles around the airways, making it easier to breathe. On the other hand, preventers are used daily to control inflammation and prevent asthma attacks. They include inhaled corticosteroids like beclomidasone and long-acting beta agonists such as salmeterol. They work by reducing inflammation and sensitivity in the airways, preventing them from reacting to triggers. Now let's talk about how these drugs work. Take short-acting beta agonists for instance. They bind to beta-2 receptors on the smooth muscles of the airways, triggering a cascade of events that cause the muscles to relax and the airways to open up. This provides instant relief during an asthma attack. In contrast, inhaled corticosteroids work by inhibiting the inflammation process, reducing swelling and mucus production in the airways. They achieve this by suppressing the activity of certain genes that contribute to the inflammatory response. This helps to prevent asthma attacks from occurring in the first place. But like all drugs, these also come with potential side effects. Short-acting beta agonists may cause a rapid heartbeat, while inhaled corticosteroids can lead to a sore throat or oral thrush. However, these side effects are often manageable and far outweighed by the benefits of these drugs. In a nutshell, the pharmacology of drugs used in bronchial asthma involves a complex interaction of mechanisms aimed at opening up the airways and reducing inflammation. These drugs not only alleviate symptoms but can save lives during an asthma attack. Remember, understanding these drugs and their mechanisms is key to managing and treating bronchial asthma effectively. Coughing persistently or struggling to breathe? It could be chronic obstructive pulmonary disease. Also known as COPD, this condition is a group of lung diseases that block airflow and make it difficult to breathe. Emphysema and chronic bronchitis are the two most common conditions that contribute to COPD. Distinctively, COPD is usually caused by long-term exposure to irritating gases or particulate matter, often from cigarette smoke. People with COPD are at increased risk of developing heart disease and lung cancer. On the other hand, a cough is a common reflex action that clears the throat of mucus or foreign irritants. It can be a symptom of various conditions including COPD but also bronchitis, asthma, and even the common cold. So how does COPD differ from bronchial asthma, you ask? Unlike asthma, COPD is progressive and usually gets worse over time. Even with treatment, the lung damage in COPD cannot be reversed. Now let's explore the drugs used to manage these two conditions. The right medication can make all the difference when dealing with COPD and cough. So let's dive into the pharmacology of drugs used in these conditions. First up, we have bronchodilators. They're commonly used in the treatment of COPD to relax the muscles around the airways, making breathing easier. There are two main types: short-acting bronchodilators, such as albuterol, and long-acting bronchodilators, like tiotropium. But remember, these drugs don't reduce inflammation, they just make it easier to breathe. Next, we have inhaled corticosteroids. These are anti-inflammatory drugs that reduce swelling and mucus production in the airways. They're often used in combination with long-acting bronchodilators for a more effective treatment. However, they can have side effects such as hoarseness, thrush, and in rare cases, they might weaken the immune system. Thirdly, there's a group of drugs called phosphodiesterase 4 inhibitors like roflumilast. These are used to decrease flare-ups in severe COPD. They work by reducing inflammation and relaxing the muscles in the airways. They do have side effects though, including diarrhea, weight loss, and nausea. Now, onto cough medicines. These can be divided into two categories: antitussives and expectorants. Antitussives like dextromethorphan suppress the cough reflex and are used for dry hacking coughs. Expectorants, on the other hand, are used for productive coughs. They thin the mucus, making it easier to cough up. Guaifenesin is a common expectorant. In addition to these, antibiotics might be prescribed if there's a bacterial infection, and vaccinations are recommended to prevent infections that could worsen COPD. As always, it's important to remember that while these drugs can manage symptoms and improve quality of life, they cannot cure COPD or chronic cough. Regular checkups and lifestyle changes are also crucial parts of the treatment plan. Understanding these drugs helps healthcare professionals provide the best possible treatment. In a nutshell, the complexity of respiratory disorders demands a comprehensive understanding of pharmacology. We've journeyed together through the intricate world of respiratory tract disorders, delving into the specifics of bronchial asthma, COPD, and cough. We've unpacked the pharmacology of the drugs employed in their treatment, and I hope our journey has been as enlightening for you as it was for me. We started by painting a picture of what respiratory tract disorders are, laying the foundation for our deep dive into the specifics of bronchial asthma. We explored how bronchial asthma, a chronic inflammatory disorder of the airways, can be managed effectively through a combination of quick relief and long-term control medications. Drugs like beta-2 agonists, corticosteroids, and leukotriene modifiers aren't just tongue twisters, they're lifesavers, helping to control and prevent asthma symptoms. Then we shifted gears to COPD and cough. Two conditions that may seem less daunting than asthma, but are equally challenging to manage. We saw how COPD, a group of lung diseases that block airflow and make it difficult to breathe, is often treated with bronchodilators, inhaled steroids, and phosphodiesterase 4 inhibitors. And we didn't forget the common cough, exploring the role of expectorants and antitussives in its treatment. In every step of our journey, we've seen how understanding the pharmacology of these drugs isn't just about memorizing names and mechanisms. It's about appreciating the art and science of medicine, about seeing how these drugs can transform lives, offering relief and hope to those suffering from these conditions. And so, our journey doesn't end here. There's a whole world of pharmacology waiting to be explored, full of more diseases, more drugs, and more opportunities to learn and grow. So, hit that subscribe button because trust me, you won't want to miss what's coming next. Subscribe for more because you won't find me later. Continue your learning journey with us to make complex topics simple.